So we're here today with Dr. Deborah Penchars. She's a registrar in nuclear medicine, and she's just going to talk a bit about what she enjoys about nuclear medicine and why she came to choose it. First question is, why did you choose nuclear medicine?
Well, I like the combination of basic science, particularly nuclear medicine physics, and then also basic medical science, so anatomy and physiology and pathophysiology, combining that with clinical medicine. Sort of felt that you get less of that when you're doing clinical medicine on the wards, and I also like the diagnostic side to it. I'd always liked the problem-solving investigative side of looking after patients, and most of nuclear medicine's about that, so that was interesting. And then it's still multi-system, that we do scans for all the different systems, so you still have to know and be involved in all those systems, which is interesting, rather than focusing more narrowly down one. And then I like the fact that it's not all patient contact time or all clinical. Quite a lot of the time is spent reporting, but then there's still some contact with patients if you want it. So it's lots of things, yeah.
How did you hear about nuclear medicine? Because it's not necessarily a particularly well-known specialty.
Well, I had some difficulty deciding what specialty I wanted to do, and then a bit randomly my husband's friend came round for dinner, and he'd been practicing nuclear medicine in Australia actually, and I'd always assumed that nuclear medicine was something that radiologists did and it was part of radiology, but no, he explained that lots of physicians do it and you can do it via physician training. So I thought that sounded really interesting, and I started to look into it and thought that I'd enjoy it and it would suit me, so I applied. Yeah.
And what do you enjoy most about your training at the moment?
I enjoy, I think, improving my skills and my knowledge, and feeling more confident in reporting, and feeling that my reports are getting more accurate. Yeah, it's always enjoyable to learn new things, and I like the fact that I enjoy my job, and I'm happy to go to work, and I think I've chosen the right specialty, because in the past I hadn't always enjoyed my job, but I really like nuclear medicine, so those things I like. And then I like some contact with patients and some not, and nuclear medicine's got a big sort of multidisciplinary team with very experienced technologists and physicists and radiopharmacists, and I really like working with lots of different people as well, so quite a lot of things I like. Yeah.
Is there anything that you didn't know about nuclear medicine that you've discovered in your training that is kind of a real positive for you?
Well, I suppose I didn't really know much about it when I started, so I've learnt lots of things about it, and I'm not sure what's the thing I'm least learnt the most. I don't think I'd realised the breadth of therapies that nuclear medicine can do. I'd known about radioactive iodine, but not about sort of peptide receptor radionuclide therapy or treatment for sort of bone disease and bone metastases. So I think that's it, the breadth of therapies I really wasn't aware of before I started training.
So how does the training in nuclear medicine work? How is it different from other specialties?
Well, historically you could either train via the physician route or the radiology route. Physician route was 4 years post MRCP, radiology route was 2 years post radiology training, but actually there's a whole new training scheme that's just going to be starting next year, which will be 6 years post core medical training and MRCP. It'll be 3 years of basic radiology and then 3 years of nuclear medicine, and it sort of solves the problems that had existed before in nuclear medicine training, whereby physician trainees probably didn't have enough radiology experience, and radiology trainees probably didn't have enough physician experience, and so it's solved all of those problems, and it's going to be a really excellent training scheme.
And say you're sat with a foundation doctor or a core medical trainee, and they were kind of thinking about what specialty they wanted to do, how would you persuade them to select nuclear medicine?
Well, I think everyone should consider nuclear medicine an option, because I do think it's a very good job, and the training will be sort of longer than for other medical specialties. It's going to be 6 years post core medical training and MRCP, and there are going to be more exams than other specialties, but at the end I think you come out as a very highly trained, highly skilled specialist in a very interesting specialty that will always continue to grow, and there's always new developments, and particularly as a consultant and as a registrar, it's got an excellent work-life balance, that there's very little out of hours. Nuclear medicine is very rarely used as an emergency, and so although the training's a bit longer, at the end you're a specialist in this great specialty that combines very nicely with your life, and I would definitely recommend it.